Koutou katoa, warm Pacific greetings from Aotearoa, New Zealand. My name is George Parker. I am a lecturer in health service delivery at Te Herenga Waka, Victoria, University of Wellington. My background's in midwifery. I no longer work in clinical practice. I am also the lead investigator on a Health Research Council of New Zealand funded study looking at trans and non-binary inclusive pregnancy and birth care. I'm a Pākeha, queer, non-binary person. My pronouns are they and them. Yeah, so we are approximately a year into an 18-month study looking at the whole area of trans and non-binary inclusive perinatal care. So for us, that's people who are trying to conceive through pregnancy and into the early months of parenting, who identify as gender diverse, so trans, non-binary, agender, and other gender diverse identities, and or who are the partner of someone having a baby who identifies as gender diverse. So we're taking a whānau or family-centered approach to the study, and it's set up in two phases. So phase one was very much about finding our gender diverse family having babies and hearing about their experiences and reflections on their care journeys. The second phase of the study was about shifting focus from our gender diverse families having their babies to the perinatal workforce. So midwives, obstetricians, ultrasonographers, radiographers, childbirth educators, lactation consultants, anyone who's a neonatologist, anyone who's making up that wider fabric of perinatal care services. And we wanted to know, are we preparing our workforce to provide gender inclusive and affirming care to gender diverse families? What is the knowledge and beliefs and attitudes from our perinatal workforce towards gender diverse families? And what could we be doing better? What are our priorities to be preparing our workforce? And I think between those two data sets, we're going to be able to draw out a pretty informative picture, both of where we're at currently around gender inclusive and affirming perinatal care, and also where we need to get to, and hopefully how we're going to get there. So it's a cross-institution collaboration. I'm leading the project at Te Herenga Waka, Victoria, University of Wellington, but in close partnership with the midwifery school at Otago Polytechnic, and two wonderful colleagues, Professor Sally Baddock and Associate Professor Suzanne Miller from the midwifery school. So we've got that really wonderful kind of partnership, and we're also working with Dr. Jamie Veal, who runs the Trans Health Research Lab at the University of Waikato, and Dr. Elizabeth Kirikiri, who is our Māori takatāpui scholar here in Aotearoa, who's been a really instrumental person in bringing that Indigenous perspective into the conversation of gender diverse and sexuality diverse identities, and talking about what it means to be sexuality and gender diverse in Māori worldviews. So yeah, an amazing team, and we've got our main project lead, our research assistant, is a young trans man, Alex Carr, who's really passionate and talented in this area, and we have a parent advisor, Scout Barbara Evans, who's a trans parent advocate, who's kind of keeping us connected and real around and accountable to the families that we're working with. So what we're trying to do is centre the voices and experiences of trans and non-binary people who are in their family building journeys moving through perinatal care as the issue. So the issue is that we are not delivering equitable, safe and quality care to trans, non-binary and other gender diverse people. We knew that before our study, that we've already got quite a powerful and growing body of evidence globally that's demonstrating that, and certainly the preliminary findings we're starting to bring out of phase 1 is confirming that. We know that gender diverse people come into perinatal care already with compromised health and well-being as a result of lifelong exposure to minority stresses, to those social determinants of health, where being gender diverse in the world is stressful. It positions you in ways that where you experience discrimination, hostility, microaggressions as you move through the world. And so when our families are coming into perinatal care, they're already in a compromised place around their physical and mental, spiritual health and well-being. And then when they have an experience of, and you know, perinatal care is a prolonged experience, and for most generally kind of robust and well younger people, it can be one of their first really prolonged experiences of healthcare exposure. So our families are coming into perinatal care, and then what they're telling us is that they don't feel good there. They don't feel welcome. They don't feel safe. They're exposed to both that tip of the iceberg, like quite hostile or transphobic behaviors sometimes, but much more frequently they're exposed to norms and assumptions and all those microaggressions right throughout perinatal services that say they're not seen, they're not welcome, that their care providers aren't being attentive to them, aren't recognizing them, aren't committed to knowing them, and therefore that they're not really safe, that they can't trust their perinatal care providers. There's nowhere for them or their partners to safely use the bathroom. There's no visual representations of their families on the wall. There's no one takes the time to ask their gender, ask their pronouns. They're dead named, you know, all the kind of fabric of what inclusive care looks like spans physical design, infrastructure, relational encounters, and yes, language is one of those. Language is a powerful communicator for whether services understand inequities for trans and non-binary people and are committed to doing something about it. But the issue in of itself is not language. Language is simply an expression of the issue, which is gender essentialist care that doesn't either understand or is not committed to inclusion, respect, and safety for our families. So equity issues are at the heart of midwifery, and that equity issues are not a pie. We are not in a position in midwifery where we need to feel like equity and justice for cis women and a feminist agenda is in conflict with trans and non-binary inclusion, is in conflict with racial justice in midwifery, is in conflict with disability justice, and so I feel like the number one feature of trans and non-binary inclusive midwifery is actually intersectional midwifery. It's a midwifery that is moving forward all equity and social justice issues and in ways that provide allyship and support to deeply embed and continue to embed justice and equity at the heart of midwifery. So in a way, I would say the number one feature of trans and non-binary inclusive midwifery is actually a midwifery that's pursuing feminist intersectional justice, because this is not about progressing equity and justice for our community and trying to leave other communities behind, let alone that there are plenty of Indigenous, disabled, neurodivergent, queer and trans people also. So obviously identities are intersecting, but also our equity challenges for midwifery are intersecting. So that's number one. But if we then drill down into what an agenda of trans and non-binary inclusive midwifery looks like, fundamentally I would say that is a midwifery that is being supported to develop cultural safety, cultural humility, in relation to gender diverse people and to sexuality diverse people and to others. So midwifery, deeply embedded in reflective practice about gender essentialism, about norms and assumptions in relation to gender, sexuality, relationship norms, and that can come at all people, at all family, at all aspects of midwifery practice, whether that's service development, service design, service delivery, from a place of awareness and reflection and humility around norms and assumptions. And that's only going to happen if we start in midwifery education and we embed cultural humility and cultural safety within midwifery education, and we continue to support our workforce right through. So that's a big one for me. We're also hearing clearly from midwifery that we need professional bodies in midwifery that are leading and setting the mandate for trans and non-binary inclusion, who say, yes, this is an issue of equity. Yes, midwifery is committed to equity. So yes, of course, we will lead and mandate responsiveness and inclusion for gender diverse people in midwifery. So leadership, cultural humility embedded right through in pre and post midwifery education. We need service design, physical infrastructure, whether that's electronic infrastructure like data systems, as well as physical spaces and services that communicate to trans and non-binary people that they're regarded, that they're thought of, that they're welcome, that we support them to be visible, and from once we are there, that we provide them warm, inclusive, and safe care. And that's, like I said earlier, that's in bathroom facilities for families, that's in physical representation in services like posters and information resources. It's in how we deliver childbirth education. It's a midwife who says, meets a family for the first time, says, good morning, I'm Jane, my pronouns are she, her, it's great to meet you, can I check your gender, what is your pronouns? We know from research that cis people, for the most part, that'll go well over their heads, but we know for gender diverse people, we are very watchful in healthcare that people know who we are, know how to care for us, and it goes miles. It is in the language we use, but again, not as a kind of disconnected debate, but in the ways that we use language that creates the opportunity for trans and non-binary people to literally exist. That is, yes, we will open up a space that allows you to tell us who you are, and then once you've done that, we will use language that communicates to you that our services are for you, that your care is appropriate, that our care is appropriate to your family. So yes, language, but in a very operational, lived, exercise day-to-day way. It is systems that ensure that the person on the front desk is trained in cultural humility and safety, and so when someone masculine presenting appears with a non-traditional female name, that the receptionist knows to use the name that the person gives that person, not the one that might be on her paper or his paper or their paper. And so it's systems, it's processes, it's culture. That for me is what trans and non-binary inclusive care is. If we centre this as a critical equity issue, then it's the question for midwifery is not if midwifery is going on this journey, but it's that midwifery has to go on this journey.